If you've ever suctioned a toddler and or a baby, then you already know it ain't pretty, it ain't easy, and for a lot of parents, it's very anxiety-provoking. Hi, I'm Dr. Quadri. I'm a board-certified pediatrician, urgent care doc, and mom of 3, and unfortunately, I have to do this a lot. Most children don't develop the ability to properly blow their nose until around 2 to 4 years old, and even then, it's iffy. But when that cold season hits, you want to do whatever you can to decrease the accumulation of what I like to professionally call nose gunk, which will make it easier for your baby to sleep, breathe, eat, and decrease the risk of ear infections. The easiest way to do this is suctioning the nose. This is a skill that many parents are uncomfortable doing properly for fear of hurting their kid or because you really just don't want to have to deal with baby Hulk. I verbally try to explain and show parents how to do this, what I consider the most efficient way at home, but it's much easier to watch. So here I am, suctioning my very upset 3-year-old. I personally think it's easier and safer to do this on my own because I can control the baby's body and my body. You can do this sitting on the floor, or if you're like my husband and have zero mobility, then you can sit up against something for back support. Position your baby with their head at your crotch, yes, crotch, and then have their arms out in a T position pinned underneath your thighs. This prevents them from being able to swat at you, and it keeps your head in a stable position while also allowing their legs to be free to scream and move and kick, do whatever they need to do to show that they're frustrated and really mad at you. I recommend using saline first, 2 to 3 sprays or drops in each nostril, preferably hypertonic saline. Let it sit for a couple of seconds, and then choose your weapon. Now, there are many different types of suction tools out there. I prefer to use a bulb suction or a little vacuum suction that I have at home as well, depending on how much gunk I think is there. With a bulb suction, you do have to have some skill. So importantly, please push out on the bulb before you place it in your baby's nose. Then you release the bulb, allow it to inflate, and then pull it back out and push out again to expel whatever nasties are inside. Repeat this on either side until the nose is clear, and then let your baby get up so that they can yell at you some more, give them a hug, and encourage them that they've done a good job.